Thanks, guys. Excited to be here. Came down from Toronto. It's been a long journey, but we made it. I looked at my talk, steps forward, AMA's practice improvement strategies, and thought, sounds really boring, not very aspirational, not very motivating. So I thought, in the interest of that, I'd actually change the title of my talk to, how user experience design can help address an invisible crisis in U.S. healthcare. And that's really what Steps Forward is all about, and that's what, I'm going to share that story with you today. So just by way of introduction, really quickly, my name is Mike Melnick. Like I said, I'm from Toronto. I got 2 kids. I have an unhealthy obsession with sourdough bread. I bake it, I eat it, whatever. I'm fortunate enough to lead the UX practice at Klick Health. A little bit about Klick. We're the world's largest independent agency focused on health. We're about 700 people, about 600 in Toronto, about 100 in the US. We're really focused on culture, having fun at work. That guy in the top left that looks like Pinhead is actually the CEO. I don't know if those words have ever been spoken before. Pinhead is the CEO. That's the UX team right there in the top. We're focused on culture, like I said, and we love what we do. So back to the project at hand. So I talked a little bit about a crisis in US healthcare, and take you back a few years to 2013, and the AMA, the American Medical Association, who was our client, the largest association of physicians and students in the US, partnered with RAND Corporation, which is a think tank based in the US, mostly focused on research in the public sector, shaping public policy. They conducted a massive study across the medicine practice in the US, and the results were actually quite shocking. They found out that more than half of the general practice practitioners were experiencing symptoms of burnout. And I mean major burnout. Bigger than that, even more seriously, fewer physicians are choosing general practice, and many of them are actually leaving that area of medicine. And when you think about it, that's a major problem. Physicians, the general practitioners are the physicians that we see the most often. These are our family doctors, our GPs that we interface with most often. And when you think about it, their dissatisfaction has a huge impact to the health of the nation. Because there's an extremely strong correlation between physician satisfaction and the quality of patient care. And so earlier today, we saw some talks about how there are projects that are focused on patient experience. And I love seeing that kind of thing because we work in it and we see it, and it needs a lot of UX love, as I like to say. So what was Klick's involvement in this? The AMA issued a request for a proposal, needing help to kind of disseminate these materials they had put together to help educate physicians on how to run more effective and efficient practices. The reason why the physicians were unhappy is because they're turning their back to their patients a lot physically, in that they're really focused on data entry. They're not talking to patients as much as they used to, and really that's why they went into medicine. So that was almost removed from them over the last few years. So the AMA started to create these learning modules around how to run more efficient practices to give time back to the physicians. I mean, these are people after all. Right? They want to get home to their families, spend time with their kids. And the content that the AMA provided us when we were looking at it and the cause of the project, everyone was kind of raising their hands to get involved. It was really, really inspiring, extremely impactful, and very meaningful work. So let's jump into the fun stuff. So how do we tackle the design challenge of something like this that was so far-reaching yet so meaningful? The first thing we do is try to understand our audience. And at Klick, we were lucky to have worked in the professional space quite a bit. And when you looked at the healthcare professional audience, it really comes down to 3 main persona traits, if you want to call it. The first one is very little time. Like, seriously, these physicians are burnt out, obviously, the ones that we're designing for. And so how do you kind of account for that when you're designing a web interface? The second is extremely skeptical. They're skeptical by nature. Anything unfamiliar to them, they're going to start to question. I think a lot of the physicians that we met actually in testing gave us that exact look when they saw the program. And lastly, they'll stick with what works. They're creatures of habit. So anytime you show them anything new, they're willing to listen if you present some data alongside of that, or their colleagues have told them something different. So that's kind of a crack in the armor, if you want to say. And another layer of complexity behind all this was the brand perception of the American Medical Association. So what we learned was across the board, the physicians had a very wide-ranging opinion of the AMA, and we were concerned that opinion would then color their opinion of the Steps Forward program. So that was kind of top of mind for us as well. So looking at kind of the other side of the coin, so many design challenges from an organizational perspective. How might we demonstrate value right off the bat? So getting those physicians that are short on time over the hump of understanding, boom, okay, I get it, I'm in, I'm interested, you got me. Secondly, how do you encourage module implementation? And this goes beyond reading about the module on how to run a more effective practice. It really doesn't make a difference unless you're implementing into the practice. So we really focused on that as well. How do we differentiate the program overall from others they may have seen? And then lastly, we needed to design in a scalable way. I mean, the expectation was that this program would grow over time, so we really needed to approach it in a more modular way, enabling the AMA to add content as the program grew. So I'm not going to spend too much time talking about the specific features. I mean, that slide is pretty rich. But what's interesting here is the approach that we took. Like, we really set up a series of design guidelines, social proof, demonstrating value early and often, emphasizing emotion, authenticity, and credibility. No stock images. I think 90% of the properties out there that are geared towards physician have the happy physician with his arms crossed. None of that was happening here. And lastly, we did some research around how physicians typically consume educational content, and we were really shocked to find actually the tablet, far and away, was the #1 device that they were using. Not so much mobile, which was quite interesting. So what do we do next? Well, I mean, we rolled up our sleeves. And when I say we, I don't mean just UX. It was really a team effort on behalf of Klick, strategy, client service, project management, technology. Everyone got in there. Everyone, was really eager to help out, and that was great to see. And the collaboration happened not just internally, but with the AMA as well. So it's not often as an agency when you're working with a client, they think that they know the end user or they are the customer. In this case, actually that was true, because the stakeholders at the AMA were also practicing physicians. And so to get their perspective, to get their feedback was invaluable, because they brought all this contextual knowledge to the table that made us move not just faster, but work way more effectively. So here's, this is a video of an early prototype that we developed. So you can see that there wasn't a name, the program was not branded at all. There wasn't even very much of a creative treatment on this prototype. It was mostly wireframes. You could see that we used quite a few of micro interactions throughout the site. The user would land on the module page, and then they would click into the online module as a separate page. So we were making a lot of assumptions around how the construct kind of worked. But we all agreed, let's test this, let's see how it goes. And when the AMA aligned with us on what our objectives of testing were, we had a lot of questions that we wanted to know. But they boiled down to 4 main areas. So the first one, really, we wanted to know, did we do a good job communicating the value of the program? Does the design facilitate easy access to the content? We really wanted to have the star of the show, really, to be the content, because that's where the value was. Does the content itself resonate with physicians? Was it something that they would find interesting, and did they have other ideas for growth? And lastly, that burning question of how does the AMA brand reflect on the overall program was something that we were really, really eager to know. So into testing we went, and this is a photograph from the facility. We were in downtown Chicago. You could see that there's a tablet on the table with a document camera and a webcam and the facilitator. And I've attended dozens of these kinds of sessions, and typically you get 5 or 6 people in the immediate project team that is really interested. That was not the case here. We had 15 people from the AMA come out, about 4 or 5 people from Klick as well, and there was this energy, this buzz in the room, waiting with bated breath to see how it would be taken by the physicians. There was a lot on the line with this. The AMA told us that if the feedback wasn't positive, they would have pulled the plug on the entire project. And we felt so strongly that it had merit that we really wanted to see it succeed. So, spoiler alert, I'm up here because it succeeded. Really happy to say. So, thematic findings, a lot of the physicians were really eager to get involved. When is this thing launching? Can I sign up for it? It was just a prototype at that stage, but they were really eager to get involved. Not everything was roses and rainbows. I mean, they really questioned some of the content area, but we were really, really looking for that kind of feedback in order to improve. They assumed that it cost something because they actually saw value in it, which was really interesting insight. And the last quote, AMAs was involved with this. Wow, I'm impressed. We weren't quite sure if that was a compliment to the design or an indictment of the AMA. We weren't quite sure. But hey, that was cool. And when those kinds of comments came up, the clients in the observation room, they were high-fiving. There was a lot of energy in that room. So some other findings that came out that were really, really interesting. So we talk a lot about carrots. You know, we talk a lot about motivating physicians to engage. So what we did is we worked with the AMA to define CME credits. So CME credits are continuing medical education credits that a physician needs to maintain in order to, you know, stay in practice, to maintain their licenses. And we thought that that would be a really good carrot to dangle in front of the physicians to get them engaged in the modules. You know, not so much. They really didn't care for it. It didn't really add or take away anything. This is really a kind of a benign and very specific finding. But you know, they had no idea that clicking on the logo to go back to the homepage would actually work. We asked them, how would you go back to the homepage? And they just kind of mashed the back button in the browser. So that was kind of funny, but it reminded us of how our assumptions are, you know, just destroyed by doing these kinds of design-centered activities. And lastly, you know, we included all these interactions that nobody really touched, so we stripped that out of the final product. So this is what it looks like, or looked like at launch. It's grown quite a bit since then. So you can see that we're leading with some impactful quotes by the audience in the top right corner. A very powerful message. Copywriting played a big, big part in this. And then with one click, you know, you can get into a module. We had a carousel on a swipeable carousel that showed all the modules that you can see right there. And clicking into the online module, you know, we lead with benefits, and then scrolling down to the online module, you could see that we eliminated an entire click, and this actually boosted performance quite a bit. Notice in the top left corner, the AMA logo, very, very prominent. They were really proud of this property, and so they said, how prominent can we make the AMA logo? So we plastered it right up there in the top left corner. So at launch, this was the team. On the left side, some AMA folks, and on the right, some Klicksters. The inset photo is the CEO of the AMA, Dr. James Madera, announcing the launch of Steps Forward at a company event. Really, again, a proud moment. So let's take a moment and talk about the results. So what actually happened here? So in terms of analytics on the site, extremely low bounce rate, so 32% in terms of benchmark is really, really low. 69% module engagement rate, so we typified that by a user scrolling at least a quarter of the way through the online module. Really, really high. And here where the rubber hits the road, implementation. So 86% of the site visitors were likely to implement a Steps Forward module. But more broadly speaking, some really interesting statistics. Look at the growth of the program. If you visit the site right now, there's 50 modules on the site. So the AMA really has put a lot of momentum behind this program, and they've seen a lot of impact. Obviously, the halo effect on the AMA brand has been very positive, and the overall impact on the health of the nation has been awesome. I'll leave you with two small tidbits that we find probably the most effective. The comments that we've heard from physicians at the live events where they talk about Steps Forward implementation. Using these solutions has led to a rediscovery of the beauty of reconnecting with my patients. And really, that was the problem that we set out to solve, was physician satisfaction. And it by and large, accomplished that feat. And finally, it's been recognized by US Congress, which is really cool. It's in legislation. In macro legislation as an improvement activity for physicians. I could tell you, this is a big deal apparently. As a Canadian, it's probably the closest I'll ever get to US Congress. And I'm fine with that. I'm fine with that. But it's something that really spoke to the impact that the program's had. Yeah, and that's all I got. So thanks so much for listening.